Recent reports project that by 2030, half of all adults in the United States will be obese. One of the leading risk factors for obesity is an unhealthy diet. My name is Jay Christiansen, Health and Human Sciences educator with Purdue Extension in Vigo County. Welcome to our next installment of our food prescription video series. Today's presentation is Eating Well, a Guide to Good Nutrition. Before we get going in our presentation, I want you to take a moment to think about these three questions. What are some reasons you would choose to follow a healthy eating pattern? What does it mean to eat healthy? And how does a healthy diet contribute to health? Our presentation outline will be as followed: nutritional facts and data, what we know, healthy eating plan, barriers, and we'll end with talking about some tips. The typical American diet is too high in calories, saturated fat, sodium, and added sugars, and does not contain enough fruits, vegetables, whole grains, calcium, and fiber. In fact, according to a study published by the Centers for Disease Control and Prevention, just 1 in 10 adults meet the federal guideline for fruit and vegetable consumption. The information on this slide shows the percent of the American population below the recommendation for the listed food groups and the percent of the American population at or above the recommendation for the listed food groups. A few of the points that you can see on the screen are: more than 80% of the population do not meet the recommendations for consuming vegetables. More than 60% of the population consume more than the recommended amount for added sugars. More than 80% of the population consume more than the recommended amount for sodium. And lastly, a little more than 20% of the population meet the recommendation for consuming fruit. Only 12.2% of adults meet the daily fruit intake recommendations, and only 9.3% of adults meet the daily vegetable intake recommendations. In 2017, the percent of Indiana adults who reported consuming fruits less than 1 time daily was 40.7%. $117 million US adults have one or more chronic disease, many of which are related to poor quality eating patterns. 7 out of the top 10 leading causes of death in the United States are from chronic diseases. 1 in 3 adult Hoosiers are obese. Indiana ranks 40th worst in the United States for obesity. The obesity epidemic puts us at risk to develop chronic diseases such as heart disease, certain types of cancer, stroke, hypertension, and type 2 diabetes. Today in the United States, chronic diseases account for 70% of deaths, limiting the activities of tens of millions more Americans. And a lifetime of healthy eating helps prevent chronic diseases like obesity, heart disease, high blood pressure, and type 2 diabetes. An unhealthy diet contributes to 678,000 deaths each year in the United States due to nutrition, obesity, and related diseases such as heart disease, cancer, and type 2 diabetes. Poor diet quality is a leading risk factor associated with death and disability in the United States. Eating a diet rich in fruits and vegetables as part of an overall healthy diet can help protect against a number of serious and costly chronic diseases, such as heart disease, type 2 diabetes, some cancers, and obesity. Fruit and vegetables also provide important vitamins and minerals that help the human body work as it should and fight off illnesses and disease. Obesity is one of the biggest drivers of healthcare costs in the United States. Currently, estimates for these costs range from $147 billion to nearly $210 billion each year. In Indiana, obesity costs Hoosiers $11.9 billion. So, as our weight increases, so does our medical claims and healthcare costs. So what exactly is a healthy eating pattern? A healthy eating pattern includes focusing on variety, nutrient density, and amount, focus on vegetables, fruits, grains, fat-free or low-fat dairy products, protein, including lean meats, chicken, eggs, beans, nuts, and healthy oils, limiting calories from added sugars and saturated fats, and reducing sodium intake, and shifting to healthier food and beverage choices. Some may think that this is included in a healthy eating pattern, but it doesn't. There are so many different eating patterns out there that it can be confusing to know which one we should follow. In fact, 8 in 10 Americans think advice about what to eat is conflicting or confusing. So let's take a look at exactly what a healthy eating pattern looks like. First, a focus on fruits. Fruits are a tasty way to add some nutrition to our snacks and meals. Choose from a variety of color, 2 cups per day. Fruit also has fiber, which provides our body with several health benefits, like helping us feel full, lowering cholesterol, and helping to keep us regular. Second, vary your veggie routine. Eat from all the subgroups: dark green, red, orange, beans, starch. Vegetables are a nutritional bargain, so we can eat them in larger servings and more often. The recommended daily amount is 2.5 cups. Third, vary your protein. This would include lean meats, chicken, eggs, seafood, beans, and nuts. Limit your processed meats. A serving of protein is 3 ounces, which is about the size of your palm. Fourth, make half of your grains whole. Shifting from refined to whole grains. People who eat whole grains as part of a healthy diet have a reduced risk of chronic diseases. Grains are an important source of many nutrients, including fiber, which helps you to feel fuller. 5, move to fat-free or low-fat dairy products. The recommendation for dairy is 3 cups per day. And 6, limit calories from added sugars and saturated fat and reduce sodium intake. In regards to sodium, the average American consumes more than 3,400 milligrams each day. The recommendation is less than 2,300 milligrams per day, which is about the size of a teaspoon. And the vast majority of the salt consumed comes from processed foods, not from the salt shaker. In regards to fat, limit calories from this to 10% of your total calories. Diets high in saturated and trans fats are associated with heart disease. And lastly, added sugars. Sugar added to food and beverages are added to our food and beverages during the process stage. The recommendation for added sugars is 9 teaspoons for men and 6 teaspoons for women. Additionally, calorie balance is a key to weight management. Calorie balance means that the calories we consume from foods and drinks should equal the calories we burn through our normal daily functions and through physical activity. A couple things that we can remember is we can enjoy the food we eat, but eat less. And 2, avoid oversized portions. Food portions have changed a lot over the years. The size and amount of calories in food has grown much larger. Larger portions does add up. Just 100 extra calories a day equals to 10 extra pounds per year. How much do I need each day from each of these food groups? Some of these were mentioned on a previous slide. We'll mention a few again. Vegetables, the recommendation is for 2.5 cups a day. Fruit, 2 cups per day. Grains, 6 ounces per day. Dairy, 3 cups a day. Protein, 5.5 ounces per day. And oils, 27 grams per day. Contrary to what you might think, portion control does not require taking drastic measures. One helpful way to control your portion size is visualizing commonly used items to serve as a guide to help you easily identify accurate portions. 1 cup equals the size of 1 baseball or 2 cupped hands. A half cup equals 1 cupped hand. 1 serving of meat equals 2 to 3 ounces, which is the size of a deck of cards or the size of your palm. A teaspoon equals the tip of the thumb to the first joint, or 1 dice. 1 tablespoon equals 3 thumb tips. A hockey puck equals a half cup pasta or dry cereal, a half of a bagel, 1 slice of whole grain bread, or a half of a medium potato. Remember, That portion is not the same as a serving. A portion is an amount of food on your plate. A serving is a specific amount of food that equals a certain number of calories. Often the portion you eat contains more than one serving. Keep that in mind while you're cooking and making food selections. Fruits and vegetables are a key part of an overall healthy eating pattern. They are also delicious, colorful, versatile, convenient, affordable, and fun. Here's a quick tip to add some more color with your fruits and vegetables. Fruits and vegetables provide many beneficial nutrients, including vitamins, minerals, healthy fats, protein, calcium, fiber, and antioxidants. Add fruits and veggies to your meals and snacks for a nutritional power boost. Fruits and vegetables typically contain no trans fat, low saturated fat, and very little or no sodium. The natural sugars they contain don't affect your health the same way added sugars do, especially if you eat the whole fruit or vegetable. Fruits and vegetables tend to be low in calories, so they can help you to manage your weight while still filling you up, thanks to the fiber and water they contain. Replacing high-calorie foods with fruits and vegetables is an easy first step to a healthier eating plan. And last, a healthy eating plan rich in fruits and vegetables can help lower your risk of many serious and chronic health conditions, including heart disease, stroke, obesity, high blood pressure, high blood cholesterol, diabetes, kidney disease, osteoporosis, and some types of cancer. They're also essential to many daily functions of a healthy body. If you are already eating plenty of fruits and vegetables every day, you may be ready for the next step, which is to include more color. All fruits and vegetables contain vitamins, minerals, and other nutrients that may help prevent chronic diseases. If you're looking for more ways to sneak in fruits and vegetables into your meals, here are a few tips that you can follow. For breakfast, add fruit to your cereal. For lunch, put vegetables on your sandwich. For dinner, add a side of steamed veggies. And for snack, keep raw veggies on hand or have any type of fresh fruit. So here's a challenge. Over the course of the next week, keep track and see how many fruits and veggies you're eating. If you're not meeting the daily recommended amount, try to improve and challenge your family also to a weekly competition. Remember, the recommended vegetable consumption is 2.5 cups. For fruit, it's 2 cups. Now, along the way, there will be roadblocks as you continue on your journey towards healthier eating. Have you encountered these? How have you addressed them? What are some helpful ways to break down these barriers? And so we'll take a look at a few. The first is old habits. Notice when you feel full to stop eating. Try smaller plates, bowls, or cups. At tempting places like parties, don't stand next to the food. Bring food with you if you know that food available will not fit into your healthy eating plan. Third, it may take a longer time to make healthier food. To help, make menus and grocery lists for the week to have supplies on hand. Cook extra food on the weekend and freeze it. The next barrier is cost. Take advantage of sales on healthy foods or plant a vegetable garden. Next is taste. Try to incorporate a new recipe with a fruit or vegetable every few days. And last, family pressures. Share what you've learned with your family and ask for their support. Here are some other additional tips. Reading the food label is very important. Some things to consider when we're reading the food label is, first, to look at the serving size. Second, consider the amount of calories within your food. Third, limit certain nutrients that are listed on the food label. 4, get enough of the nutrients listed in red. 5, look to see the % daily value. And 6, there's footnotes with daily values for that particular food item. The U.S. Food and Drug Administration has updated the nutrition facts label. What differences do you see between the original and the new nutrition facts label? Let's go through a few things. The serving size has been updated to be more realistic to reflect what people actually eat and drink. The number of calories is also in a larger, bolder font. Calories from fat has been removed. Since research shows the type of fat a person consumes is more important than the amount. Added sugars in grams and as percent daily value is now required on the label. Grams aren't required for single ingredients, such as sugars. The list of nutrients has been updated. Vitamin D and potassium are now required on our label because Americans don't always get the recommended amount. Vitamin A and C are no longer required. The actual amount, in addition to their percent daily value, must also be listed for vitamin D, calcium, iron, and potassium. And lastly, the daily values for nutrients have been updated based on new scientific evidence. The footnote at the bottom of the label has also been changed to better explain the meaning of percent daily values. So other things that are new. The serving per container, the total number of servings in the entire food package or container. The serving size, which is the amount of food that most people typically eat at a time. The calories per serving is based off of 2,000 calories per day. Remember, calorie needs are different for everybody. To achieve or maintain a healthy weight, balance the number of calories you eat and drink with the number of calories your body uses. As a review, the new label includes new features such as serving size in a bolder font, updated serving sizes, calories in larger font, updated daily values, added sugars, and changes in required nutrients with actual amounts. And here you can see some of those things appear on the screen that we just talked about. We too can make healthy choices, and simple changes start with us. First, we can choose mindfully. Second, read labels. Compare nutrition information on package labels and select products with the lowest amount of sodium, added sugars, saturated fats, and trans fats. 3, we can watch our calories. If you want to lose or maintain your weight, take in fewer calories or burn more during exercises. 4, eat reasonable portions. Often this is less than you are served, especially when eating out. Food portions have grown over the last 20 years. Remember, 100 more calories a day adds up to 10 extra pounds in a year. 5, cook at home. Eating at home allows you to control the ingredients and preparation method. And 6, look for the heart check mark on the label. This logo is easily identifiable and can help you recognize foods that are part of a healthy eating pattern. Remember, everything you eat matters. Start with small changes to make healthier choices. Small shifts in food choices over the course of a day, week, or even a meal can have a big difference in working towards healthy eating patterns that work for you. Now it's time for change. SMART is an acronym that you can use to help create goals. To reach your goals, make sure they are specific, measurable, obtainable, relevant, and time-bound. And we'll take a moment to talk about each of these. First, specific. Our goals need to be clear. What do you want to accomplish? Who do you need to involve? And what resources do you need? Next, our goal needs to be measurable. It needs to be measurable so that we can tell if we've made progress towards or away from our goal. Third, our goal needs to be obtainable or achievable. Your goal should stretch your abilities, but you do not want it to be too difficult so that you are unable to achieve your goal. Fourth, our goal needs to be relevant or realistic. Why is this goal important to you? Does this goal matter to you? Are you able to achieve it given your current situation and resources? And 5, our goal needs to be time-bound or time-based. Our goals need to have a target date or an end date to work towards. Now that we've learned how to set goals using the SMART technique, you can begin to create your own nutritional goals. But remember, our goals need to be specific, measurable, obtainable, relevant, and time-bound. A few examples that we might include or use as a nutritional goal are, I will eat 3 servings of vegetables on at least 5 days during the next week. I will eat whole wheat bread instead of white bread for sandwiches at lunchtime over the next 2 weeks. And last, if you usually use whole milk, our goal would be I will buy 2% milk for 1 month, then I will move to 1% milk for a month. A lifetime of healthy eating helps prevent chronic diseases like obesity, heart disease, high blood pressure, and type 2 diabetes. For more information about Purdue Extension and the programs and events we offer in our community, visit our website at extension.purdue.edu/Vigo or visit our Facebook page at Purdue Extension, Vigo County.